How you gonna change the things around you? Oh, what you gonna love inside of you? Oh, when you gonna hear his revelation? Oh, let it move inside of you.
Good evening and welcome to Infinite Perspective. We are so honored to have another amazing guest tonight, and I would say special guest. We have Dr. Lipman of the Atlanta Fibroid Center, and of course, Infinite Perspective is brought to you this evening by Peer Next Level Promotion, the Vision Goddess, Carlotta Cole, the brand, and in memory of Moniker Me. And Dr. Lipman, we would like to welcome you officially and ask that you introduce yourself to the audience and let them know what it is that you do.
Well, my name is Dr. John Lipman. I'm the founder and medical director of the Atlanta Fibroid Center. I've had the privilege of practicing here in Atlanta since 1991. My practice focuses specifically on women suffering with uterine fibroids.
Yes, absolutely. So what exactly is fibroids, Dr. Lipman? Because a lot of people are like, fibroids? What is fibroids? And is this something that I should be absolutely concerned about?
Well, fibroids are the most common pelvic tumor seen in women. 1 of every 3 adult women have these benign tumors, and up to 80% of women of color have these benign tumors. So on the one hand, they're not cancerous, they're benign tumors, so that's good, but they can cause a lot of misery in a lot of women, particularly African-American women. And it is the most common reason why women have heavy periods, and we can talk about that. And sometimes women bleed so long and so heavy, they don't realize it's not normal. It's also, unfortunately, the number 1 reason why women undergo hysterectomy in this country. And that's really the message, I think, for tonight, is that no matter what your gynecologist tells you, if you're struggling with uterine fibroids, you don't have to have a hysterectomy. It is an option, but it should be the option of last resort. Hysterectomy is the 2nd most common surgery performed in the United States, which is kind of staggering to me because half the population doesn't even have a uterus, and the average age of hysterectomy is less than 40. So these are young women, and I've seen way too many women less than 30 have already had hysterectomy. I spoke at Tuskegee University not long ago, and 3 women out of the audience came up after my talk crying. They were all under 30. They had already had hysterectomies. None of them wanted it, but they were suffering so badly they gave in, and they didn't know about this great option, UFE, that we perform. And so that's why I'm so grateful to be on this platform tonight and, talking about fibroids and talking about ways that women can completely avoid surgery. So it is very important for everyone to know about it. I just the other 2 nights ago spoke at a platform called Sugar Daddies, and this was men. These are men, primarily African-American men, that have a lifestyle of kind of players and all this. And you'd say, like, well, why are we talking about periods and fibroids? But men have women in their life, and men have to understand about periods and what they can encounter. So while even that group of individuals was interested in like trying to understand and get their arms around this, because they're seeing it in their world. So it's very important for everyone, but particularly African-American women and men.
Yes, this is true. Linda, did you have a question before I post mine?
Yes. You said something in the very beginning about American women being the large population of American women are stricken with fibroids. Do you think that it is diet related, that it's American women?
Definitely dietary related. I mean, African women suffer with fibroids also, but it's interesting that a number of African women that have normal body weights and normal vitamin D can come to this country, and if they consume an American diet, they can struggle with fibroids. So there's clearly dietary effects. Unfortunately, we don't know where fibroids come from. And that's one of many health disparities, racial health disparities in the country. And because we don't put enough research money towards fibroids. Fibroids affects probably 30 million women, and it has a cost of over $30 billion a year to society. And yet it only garners $18 million a year in research. And while $18 million sounds like a lot of money for individuals, for research, it's nothing. It's puny. In fact, if you look at a condition that primarily affects Caucasians, cystic fibrosis, cystic fibrosis affects 30,000 people, not 30 million people. And has a much smaller impact to society, yet it garners $94 million a year in research. So you have a condition that affects primarily Caucasians getting over $3,000 per individual affected, with a very relatively low impact to society. And then you have another condition that has a huge impact to society, affecting 30 million Black women, as well as other, Caucasian women and other women of other races, getting about 69 cents per person affected. So the long and short of it is, I wish we knew where fibroids come from. We need more research. But once they arrive on the scene, they grow with estrogen primarily. And that's why they can grow during pregnancy, and why they tend not to be an issue for most women once they reach menopause. Estrogen is pervasive in the food and the water, unfortunately. But so it's also stored and produced in body fat. So the more body fat you have on you, the more estrogen you have, produced and stored and stimulating these fibroids to grow. So one of the reasons why African American women disproportionately suffer with fibroids is because in general they have more body fat than other racial groups.
This is true.
So what we try to do, there's certain hormone-rich foods like red meat, non-organic chicken, dairy, that we try to have people, if they can eliminate it, it's great, but at least try to identify and try to moderate the consumption of that. There are other foods that are colored fruits and vegetables that are rich in their compounds called flavonoids, which block an important enzyme in estrogen production. So if you can increase your colored fruits and vegetables, particularly yellows and oranges, colored fruits and vegetables, and limit hormone-rich foods, that's going to help exercise, lose that excess body fat. No one is saying you have to be skinny, but if you can everybody knows their ideal body weight number they'd like to get to. As close as you can get to that number, the better it'll be. And then the last piece of this is vitamin D. Vitamin D is the most powerful. It's technically not a vitamin, it's a hormone, but vitamin D is the most powerful growth inhibitor that we know of. And so if you have a normal vitamin D level, you are much less likely to suffer with fibroids. So if you can be as close to your ideal body weight, make healthy eating choices, exercise, and have a normal vitamin D, those are the things you can control. You can't control the genetic aspect. There are some families that have a high genetic predisposition for fibroids. If your mom had fibroids, you're much more likely to have fibroids too, but you can't pick your parents, so you can't do anything about the things you can't control, but there are things you can control. And if you do so effectively, you'll limit your risk for suffering with fibroids.
So with that in mind, I take vitamin D supplements, and I'm hoping that's adequate.
Yeah, it's important to get your vitamin D. It's important to get your vitamin D level checked, because they should be able to tell you how much you need. Because unlike vitamin C, where you can't overdose on vitamin C, whatever your body doesn't use, you'll pee out. But vitamin D is a fat soluble, and so you can get too much vitamin D. So you really need to have your blood level checked, and then whoever's checking your level should be able to tell you, okay, your level, based on your level, you need so many thousand units a day, whether it's 1,000, several thousand, or in some people need prescription like 50,000, like high doses.
Right. Wow. You said a mouthful. I mean, pretty much to sum it up, health is wealth. Okay.
Health is wealth. I use that very phrase when I spoke to a group of business women just last month. You know, they had all these talks about economics and finance and side hustles and all this financial information. And then I came up and I was like, you may think I'm a fish out of water here, but I got to tell you, there is none of this wealth without your health.
Absolutely. Absolutely. I concur. And, you know, I want to rewind a little bit because you said so much, and it's everything that you said absolutely made sense. And I'm hoping that our viewers are taking this in. And if you need your vitamin Ds, make sure you get them. Make sure you're getting checked. One thing you did mention, you know, you talked about hysterectomy. We know that there are so many different options for treatments out there. You mentioned UFE. A lot of people hear UFE, but they don't understand what it is or what UFE stands for. Would you mind elaborating on that?
Sure. UFE it stands for uterine fibroid embolization. It's also called uterine artery embolization, UAE. They're the same procedure, so there's no difference. It was discovered actually by accident, as a number of things in science and medicine are discovered. We've been embolizing tumors, primarily cancerous tumors, for many years. And the reason to do that is to try to devascularize these tumors, make it an easier operation for the surgeon to remove these tumors by cutting the blood supply off. That's what embolization means. When you embolize a tumor, you're cutting off the blood supply to it and starving it and, in a sense, killing it. And so we've been doing that for cancerous tumors for many years. And then someone in France got the bright idea, what if we did that prior to women undergoing hysterectomy? Even though fibroids are benign tumors, they're not cancerous. Right. They're very vascular. They have a lot of blood vessels going to them. It's a very bloody surgery. And so if you undergo embolization prior to hysterectomy, that would make it presumably a shorter, easier operation for surgeon, patient, and the anesthesiologist. So in France, they started doing that. They started embolizing fibroids prior to hysterectomy. But in France and throughout Europe and even Canada, unlike this country, in France, it's socialized medicine. So when we embolize a tumor, like a cancerous tumor in the United States, they're going right to surgery that day or at the latest the next day. But in France and in countries that have socialized medicine, you don't get non-emergent care that quickly. You have to wait for everything. You have to wait for your imaging studies, your CAT scans, your MRIs. You have to wait for elective surgery. So the women were embolized by the interventional radiologist in France, and then they were sent home to wait for their elective hysterectomy. And they would wait 6 weeks, 7 weeks, 8 weeks or more. Well, what happened while they were waiting for their surgery to come up? Their symptoms went away. So these women would call their gynecologist and say, hey, I feel great. Do I still need this second part? Do I still need this hysterectomy? And the answer was no, you don't need the second part. all you need to be is embolized, and that is a treatment that can be the treatment. And so the gynecologist who oversaw the project in France called his best friend, who was the chief of gynecology at UCLA at the time, and told him to get his interventional radiologist, who was Scott Goodwin. And Scott Goodwin did the first 11 cases of UFE done in the United States back in like 1995 or so, 1995 or 6. And he happened to be presenting at a conference, a radiology conference, on these 11 patients that he did. And I happened to be at the same conference presenting my data from patients that I embolized that had liver cancer. And I'm sitting listening to this going, wow, this sounds amazing. I'm in Atlanta. I could help so many women if I, try this, if this really works as he said, and it sure does. It's one of the biggest medical breakthroughs for women. In terms of significance, I would put it up there with the pap smear and the mammogram. It is truly transformational. It transforms women's lives that are just horrifically suffering with fibroids to a normal life.
Yeah.
You
Before you do that, Linda, I just wanted to mention that we do have comments coming in from our viewers, and I have one from Aziza Gilbert. She stated she is truly excited about this information and informative interview. So, this is absolutely showing that people need this information, and we're happy to have you. Linda, go ahead.
Well, I talk to a lot of young women. They are struggling with cysts and fibroids. And I wondered, are cysts a precursor to fibroids, or is there anything that's a precursor to a fibroid that we can be proactive and look out for?
Really, no, I wish there were. We need more research into this to try to get on the front side, the preventative side, rather than waiting for the car to break and then fix it. But again, that requires more research. But cysts involve the ovaries. They're very common, particularly in young women. They come and go. There's really, as long as they're of reasonable size, which makes up 99% of them, nothing is done about them because they go away on their own. So while women get cysts of their ovaries, and in some cases, some of the cysts can cause a lot of pain, but they will go away. They will last for maybe 2 or 3 months, and then they burst and disappear. And they can come and go. You can end up chasing these things. You see a cyst in one ovary, and you tell the woman to come back in a few months to make sure it goes away, and it went away, only to find there's a cyst in the other ovary. So, but there's really for almost all cysts, unless they get very big, and by big, I mean over 5 centimeters in size, if they're over 5 centimeters in size, they are less likely to go away on their own. And so in rare instances, the gynecologist will go in laparoscopically and remove a cyst, called a cystectomy. But for the vast majority of cysts, they are asymptomatic, and all of them go away on their own unless they're very big.
Wow. Dr. Lipman, thank you for that and clarifying some things that we're still in that stage of research. And this is why it's so important for us to get this message out to the masses and to educate, women and their families about fibroids and how on time, I should say, because July is Fibroid Awareness Month.
Yes. And
it is so important for us to acknowledge that and continue to uplift women to get checked and make sure they're talking about it. And I want to ask this question: why do you believe a lot of women do not seek professional help when they
no.
are seeing certain symptoms and signs?
It's there are multiple reasons for it. The first reason is there is certain fear about, the symptoms. Sometimes, women go through these heavy, periods, and the number one reason why women have heavy bleeding is fibroids, and so they bleed heavily. They first have to recognize that what they're doing is not normal. They may think just because they've been doing it for a long time that it's normal, and it's not. If you're bleeding such that you need more than a pad or tampon every 3 to 4 hours, if you need it more frequently than that, or you need more than one at a time, or if you're changing, blood that's gushing out or flooding, or accidents in blood, or bleeding through stuff, or seeing clots that are quarter size or bigger, all of these things are not normal no matter how long you've been doing it. So the first problem of this is that you've got to recognize what you're doing is not normal. And the second part of it is we have, unfortunately, kind of a very ugly past as far as treating primarily women of color. I'm in Atlanta, obviously, in the South. The mistrust for doctors because of unnecessary surgeries, experimentation, the Mississippi appendectomies and Fannie Lou Hamer and that sort of thing. So that's obviously still kind of a carryover that there is some mistrust present. That's an issue. There was a study done in the Journal of Women's Health about 10 years ago that looked at about 1,000 women that were suffering with fibroids. And the average time for them to come to treatment, these were women with symptomatic suffering fibroids. The average time for them to do something about it, even after they were identified as having significant symptoms, was 3.5 years, with a quarter of them waiting over 5 years. So, and when they asked why were people waiting so long, it's because they didn't want surgery. They didn't want a hysterectomy. And that was the only option given, even though this UFE procedure is and was available, it's been available for almost 30 years. I did the very first one here in the Southeast, right after I heard, Scott Goodwin's talk. So I've been doing UFE here in Atlanta for almost 30 years. And yet, women, even to this day, aren't being told about it. Most women that go to their gynecologist do not hear UFE as an option if they're suffering with fibroids. And that's just wrong, because they all know about it. This is not an educational thing. They all know about it, but they're surgeons, and most surgeons just will tell the person they're going to operate on them. They like to cut on people. There's a minority of gynecologists that will present all the options, because you're entitled to know all the options. And as the CEO of your own body, you're the one that should make the decision after hearing all your options, not just the surgical ones. But unfortunately, even to this day, most women only hear about surgery and they don't hear about UFE.
Yes. Yeah, I have to interject here. Before I moved to Detroit, from Detroit down here, that was the option that was given to me.
Yep.
A friend of mine told me about is it malomectomy or some other kind of ectomy?
Right.
But my doctor only gave me the hysterectomy option.
Yep.
And however, what happened is that I bled profusely at one of the schools that I was servicing, went to emergency, and they did a D&C. The D&C cleared out all of the I guess the clotting and everything that was happening. And ironically, it took away all of the period for a while. Right. And then I got older. Menopause began to set in, which makes me ask you, as we get older, the decrease in estrogen is what decreases the fibroid, like you said.
Right.
What makes the fibroid grow in the first place?
Well, I
And
wish
we
we could.
talked about diet.
Wish we could tell you. Nobody
Yeah.
knows where they
Mhm.
come from, but once they arrive, that's the main stimulator.
Yeah.
So it's really important to get the word out that
Yes.
get that second opinion from an interventional radiologist so that you can hear all your options. Because to say UFE is one of the biggest medical breakthroughs for women, particularly African American women who disproportionately suffer with fibroids. I'd say it's truly transformational from going from, because everything, when you're suffering with fibroids, everything you do or don't do revolves around your period, whether you work or not, whether you swim or not, or have activities or relations or not, or everything. You got to know where every bathroom is. You might carry extra clothes with you for those accidents in blood. You can't sit on your girlfriend's couch. You can't sleep on your good linens. Everything you do or don't do revolves every month. And there is such a dread, each month to face this horrific period, only for the next month to go through it again. And there is a mental side of this too, that, women are, dominating the workplace, and getting more and more women in the workplace, but they may be the only woman in their area surrounded by men who don't really understand periods. And so they keep pushing through because they don't want to let the team down, because, if they let the team down and they don't show up and they don't push through this misery, they may not hire another woman the next time around, or you may be the only woman of color. They feel that pressure that they're not going to hire another woman of color behind me if I don't push through and if I let the team down. So there's a physical aspect of this blood loss that you can't replace. So you're tired, you're anemic, you're fatigued.
Right. Thank you.
And then there's the mental side of it too. So there's both physical and mental effects that are significant.
Yeah. You said a lot there, because that was my next thing. I bet they become weakened and anemic from so much blood loss. So with this, can you go into a little bit more about iron deficiency anemia that comes along with this?
When you bleed heavily like this, you can't possibly replace what you're losing. And so in the blood is iron and hemoglobin carries the oxygen around our body. And so the clinical signs of anemia that we see every day, our patients will come in and they'll be tired, they'll be chronically fatigued, they will get lightheaded episodes, they'll get episodes where they might even pass out completely. They will get migraine-like headaches. They will get palpitations. Their heart will race because they have less circulating red cells, so their heart has to beat faster. They might go up 2 or 3 stairs, something trivial, and their heart starts beating real fast. And it's like, oh my gosh, am I out of shape? I'm getting older. They rationalize this. No, you're having these horrific periods and you're losing so much blood. Your heart has to work harder to do anything more than just being upright. They will chew or crave ice. That's a very common one. And when I ask patients, are you chewing or craving ice? They look at me in surprise, like I'm clairvoyant. Like, are you Kreskin? How did you know this? I'm like, well, you have a hemoglobin of 6. I mean, and you have all these other symptoms of anemia. And sometimes they chew crazy things, if you will, dirt, or in this Georgia white clay, kaolin.
Yes.
It's crunchy. They might chew or crave chalky mints or actual chalk itself.
Yep.
Cornstarch, like Argo. Or Argo is a big one. And so it's called pica. It has to do with a chronic iron deficiency anemia. And as soon as we do the UFE procedure on these women, they no longer have heavy periods. They build up their iron and hemoglobin normally. And so they get this rocket boost of energy they haven't seen in years. and their chewing and craving ice goes away immediately. I mean, I saw a woman that was, she couldn't help herself. She was crunching ice so much, and apparently Chick-fil-A is the crushed ice of choice that I hear. But anyway, she had fancy veneers on her, and she was crunching it, breaking her expensive dentistry. She couldn't help it because of this iron deficiency anemia from her fibroids.
Wow. Oh my goodness. You know, Dr. Lipman, you've highlighted so many things for me. You know, I'm anemic based on multiple things. You know, I do have the sickle cell trait because my mom had full-blown sickle cell. And I know that fibroids, you know, actually runs in the family. However, I've been fortunate not to have the fibroids. What I heard throughout, and I wanted to rewind a little bit and point out, you talked about the loss of blood. You talked about the heart beating. You also talked about, you know, the uterus being descended. So with the uterus being descended, that impacts a lot of things. Thinking about the impacts on the bladder, impacts on, you know, bowel functions, the way your clothes fit, and pretty much like the abdominal contour. Like, could you talk about that?
Absolutely. I mean, fibroids are hard and firm. They're like rocks, and they are felt on physical exam. So when a woman has, say, heavy menstruals, she goes to her gynecologist, they'll get a history, and they'll examine her, and they might feel these fibroids because she's soft and squishy, typically, and the tumors, the fibroids are rock hard, so it's easy to tell where they are. And if the uterus enlarges along with the fibroids, which is very common, as the fibroids get bigger, the whole uterus enlarges, and they will be described as a certain size pregnancy based on the uterine enlargement. And so these tumors are rock hard and firm, and they will press on whatever is next to them. And so fibroids come in 3 locations. The most common location is called intramural, and I'll get back to them in a moment. The next most common is submucosal. Those are the fibroids that live just underneath the lining of the uterus, and those are the ones that cause the heavy bleeding. The third location is underneath the outer covering. I'm sorry? Oh.
We didn't say anything. Keep going.
Oh. So the third location is subserosal fibroids. Those are underneath the outer covering. Those are the ones that cause the bulk-related symptoms. They grow away from the uterus, so they might press on the bladder to, like a paperweight on top of the bladder, to cause urinary frequency or waking up at night to urinate. If they're laterally, they can press on pelvic nerves to cause pelvic pain, sciatica. The same sciatica pain you get from throwing out your back, you can get from fibroids. If they live in the back of the uterus, they can press on the colon to cause chronic constipation. I had a patient today that they couldn't figure out her constipation. They did all sorts of GI studies. Well, her GI tract is fine. She's got this big posterior fibroid compressing her colon, causing the constipation. So subserosal fibroids cause the bulk symptoms. Submucosal cause the bleeding symptoms, but the most common type is in the muscle, called intramural. And so depending on which way the intramural fibroids grow will determine what symptoms they can cause. If they grow outwardly, they act more like subserosal and cause the bulk symptoms. If they grow towards the cavity of the uterus and the lining, they act more like the bleeders, the submucosal fibroids. They can grow in either direction or both. So intramural is the most common and can do either. Submucosal for bleeding, fibroids bleeding, subserosal bulk symptoms.
Now, it makes me ask this question, and I'm not trying to come as the doom and naysayer, but fibroids are benign.
Yes.
Any chance of them becoming cancerous?
No. Now, when you look at any imaging of the pelvis and you look and see, when we talk to patients, we typically what we'll see is we use MRI imaging, which is much more sophisticated, much higher resolution than ultrasound, because typically the patients have all had an ultrasound with the gynecologist because they have ultrasound in their office. That's the first thing they do to confirm what they feel on physical exam and go, yup, you've got fibroids. But the problem is ultrasound is a very low resolution imaging tool and dramatically underestimates the number of fibroids. And it also misses a lot of things that go on at the same time with the fibroids. There's a condition called adenomyosis, which is almost never diagnosed on ultrasound, and we see commonly on MRI because of the higher resolution. But when you look at somebody that has fibroids, we'll often see very typical benign appearing characteristics of a fibroid. And so we're confident that this looks like a fibroid, it should be a fibroid, but there is a extraordinarily rare chance that it's not a fibroid, it's a sarcoma, but it's very, very unusual. Most gynecologists never even see it in their entire career. And in fact, when we actually looked at the chance of something called a fibroid that's actually this cancerous sarcoma is about 1 in 2,000. 1 in 2,000. Now, the chance that someone goes to surgery to get a hysterectomy for fibroids, because there are people that go to hysterectomy for fibroids that will die during surgery, during their hysterectomy, is about 1 in 1,500. So the chance that you die during surgery is more likely than missing a sarcoma on imaging. So, well, it's, because this came up not very long ago where I saw a woman, she had about 10 what looked like fibroids in her uterus, 9 of which looked like garden variety, publish them in a textbook, fibroids. 1 looked kind of ugly. And so I was describing this to her and she started crying. And I said, I'm sorry, I didn't mean to upset you. Why are you crying? She said, well, the 9 things, those are fibroids, but that 10th thing, you're trying to set me up. You're telling me that's a cancer, right? And I'm like, whoa, time out. No. I'm saying 9 of these look like, you can publish them in a textbook. They look like fibroids all day. And she said, okay, what do you think that 10th thing is? And I said, well, it clearly looks different than all the others. Statistically, it's probably an ugly fibroid, but, and she goes, why do you think that? I said, well, fibroids are very, 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 very common. Sarcoma cancer is very, 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 very rare. And an uncommon presentation of a very common thing is statistically way more common than the typical appearance of a rare event. However, because it's so different and ugly, I think you need a hysterectomy. And she did, and it turned out to be a benign fibroid. But, that's what you have to do when something presents kind of ugly and looks ugly. You don't want to miss a cancer. So you're going to, do that. But that just goes to show you that, yes, even in an ugly thing, it was still a benign fibroid.
Yeah. I appreciate you elaborating on that, stating that the chances are very low for it to be cancerous, because I do know, speaking for most of the women in my family, those are some of the scares of why they don't go in to get these regular checkups to ensure that, they get the proper treatment, which in itself is not a great thing because, as you explain here, it can affect you in so many different ways, from iron deficiency, body dysmorphia, different things. So
right. Yeah, nobody wants to look pregnant if they're not. And,
exactly.
We see women all the time. I mean, I saw a bodybuilder that, she had this pooch and she was having some other symptoms, but really the main thing was, she couldn't compete any longer because she had this pooch from fibroids. And, I said, yeah, I get it. You could do 1,000 sit-ups a day like Nellie. It's not going to change. This rock hard fibroid is still going to make you look poochy. So until that's addressed either surgically or with this UFE procedure that we do, it's going to be an issue. And she's like, wow, I can't have surgery on that scar. Like I can't do that. And I said, well, we could do UFE, and that'll, the UFE patients go home literally with a Band-Aid. I guess we haven't talked about more of the specifics of the procedure.
Yes, do.
It's a 30-minute procedure, so it's very quick. It's done with IV and local sedation, so no general anesthetic. After the 30-minute procedure, you have about a 3-hour recovery at our center, and then you get discharged literally with a Band-Aid at the top of your leg where your leg meets your torso. That afternoon and evening, it's better couch, but the next morning, patients are up and walking around and moving about, and total recovery usually about 5 days. So I tell patients, plan on a week, but a lot of patients go back well before then.
Wow.
So it's a very minimal, like a little, if you looked at where we went in after the procedure, it would look like you cut yourself shaving or a paper cut. As I said, it's covered by the pad of a regular Band-Aid.
Oh, okay. That's
so
good.
You've talked about the UFE and the
UAE, which are the same things.
How is that different from, is laparoscopy the procedure used to complete that?
How we're guided is using X-ray guidance. So as I said, the entry point is at the very top of the right leg where the leg meets the torso, that crease. That's where the right common femoral artery is. And so that's where we enter. And I can steer a little tiny catheter like a piece of spaghetti into each of the uterine arteries one at a time. Each of the uterine arteries is like a big tree. So I have a spaghetti-sized tiny catheter in a big tree trunk. And then the tree starts branching, getting smaller and smaller and smaller branches till you get out to the leaves. The fibroids are the leaves of the tree, and I know what size those tiny peripheral branches are, and I can plug them up. And without a blood supply, those fibroids will start to die. And as they die, they soften and shrink. And as that occurs, a woman's symptoms start to fade away. The big trunk and the main branches of the uterus are all open. The uterus stays alive, and I've had numerous children born after UFE. I've had multiple twin births after UFE.
Wow.
Unlike surgery, if you undergo myomectomy surgery, once you undergo myomectomy surgery, you're going to get the #1 surgery in the United States if you're pregnant. That's a C-section. But our births have been typically full-term and vaginal.
Wow.
And so another important difference between our procedure and surgery.
That's awesome. You just flow naturally, because that was my next question, for you to elaborate on the procedure. And then you touched on the myomectomy, and we know that there are several different forms of myomectomies. I know there's robotic, laparoscopic, I believe abdominal, and so on and so forth. Right. What I wanted to ask, fibroid ablation, what's the difference between that and the UFE?
Well, ablation should, in my opinion, ablation should not be done for fibroids. It wasn't designed for fibroids, and it doesn't do anything to fibroids. So what ablation is, it is a burning, or in some cases freezing. Some people do cryoablation, but it's applying heat to destroy or cold, extreme cold, to destroy the lining of the uterus. And so there's two types of heavy bleeding. There is the very common structural causes of bleeding, led by #1, fibroids by far, but adenomyosis is a cause of heavy bleeding. Cancer of the uterus is a cause of heavy bleeding. Endometrial polyps. So there are structural uterine things that can cause heavy bleeding. Fibroids, number one by far. Then there is a group of non-structural bleeding things that cause heavy bleeding, but aren't structural and don't involve, any kind of structural thing in the uterus, like you're on blood thinning medication, or you have certain pituitary abnormalities, or blood clotting disorder, or certain other things. And so that is what the ablation was designed for, because in the non-structural heavy bleeders, the lining is the problem. And if you burn it, and they have to not be interested in fertility. So there are women that have heavy bleeding and they're not interested in fertility, and it's not structural. The problem is the lining, and you burn it and it's fine. It's perfect. That's what it was designed for. The problem is they're not very common, the non-structural things. The structural ones are very common. And when women say, well, I don't want hysterectomy, do you have anything else? They really don't, but they'll offer you this ablation, which the ablation, burning the lining, might help the bleeding a little bit in a fibroid patient, but it does nothing to the fibroid itself. And it doesn't do anything for the bulk related symptoms, which are commonly come along with the bleeding. So ablation should be reserved for these non-structural things, but unfortunately ablation is used all the time for fibroid ladies. And I see a lot of the failures because it didn't address the fibroid. That was the problem for those ladies, not the lining.
Got you. Wow. Very, very powerful information. And
it makes me wonder, because a lot of people try to stay out of the doctor's office.
Yes.
They try to find holistic ways to take care of this and take care of their medical issues. Yep. There's really no holistic approach to fibroids, is it?
Well, I would say there is a holistic approach, and I think actually it does work pretty well, but it's very strict, and so there are holistic providers that I know that I've worked with that have been successful helping women with their fibroids, but it's very strict. For instance, it involves being very strict about your diet and what you consume. You've got to be very strict along those lines. You also have to be committed to exercise and yoga and some of these other techniques that are helpful. Stress, lowering your stress, because stress involves cortisol, and cortisol affects, periods and fibroids. And so there is holistic things to do. And we talked about vitamin D and diet earlier. So yes, there are holistic things, and I would throw myself, if I had a uterus and fibroid problem, I'd throw myself into this ring. I would have a hard time doing what is required for the holistic approach. And I think a lot of my patients, we talk about such things, but it is very hard to stick to.
Are there fibroid centers that people can go and focus specifically on those issues?
Well, we have a fibroid center here in Atlanta Fibroid Center. We will incorporate some of the other holistic and naturopathic stuff as needed and as asked for. So all I do is treat women that suffer with fibroids and adenomyosis. So we are laser focused on fibroids. And just to finish a thought about myomectomies, you mentioned that there are different myomectomies. It's an important difference between myomectomy and UFE. We talked about the difference between UFE and hysterectomy, because UFE allows you to keep your uterus. Hysterectomy, you lose it. And there are a lot of reasons, and I hear this every day in the office. Oh, my doctor said I didn't need my uterus anymore because I'm not interested in children. That's an absurd statement. The uterus is very important for women. It's important for them psychologically. Women struggle without their uterus psychologically, like a man being castrated. There's a lot of sexual dysfunction, loss of libido, loss of orgasm. There's a lot of bone loss after hysterectomy, urinary leaking. We mentioned that average age of hysterectomy is less than 40. If you go to Kroger, Walgreens, Publix, where they sell adult diapers, who's on the package? Who I think belongs on the package should be an elderly man or an elderly woman. You won't see that. You'll see a woman of color, usually 35, maybe 40, because that's the target. Women that have had hysterectomies, women of color, young women, now need an adult diaper. It's tragic. So there is significant impacts for women undergoing hysterectomy, and it should be the last resort option. Myomectomy is for women that undergo surgery that want to have a chance at fertility. So they can't offer hysterectomy. And myomectomy comes basically in two varieties, either open horizontally like a C-section, or when the uterus gets so big, it's above the belly button, they can't get the skin high enough. So they'll do a vertical cut from the breastbone vertically all the way down to the pubic hairline. Or in some tragic cases, they try horizontally first, only to find out they can't make it. Then they cut them vertically. So now they have this horrific upside down T-shaped incision. So there's open myomectomy, and then there is laparoscopic. Laparoscopic is laparoscopic surgery, and that comes in two varieties, and it depends on who's holding the instruments. If the gynecologist is holding the instruments, it's traditional laparoscopic myomectomy or traditional laparoscopic hysterectomy. If robotic arms are holding the instruments and being manipulated by a gynecology surgeon at the other side of the room, that's robotic myomectomy. It's a form of laparoscopic myomectomy. But the problem with myomectomy, not only is it surgical, which UFE obviously is not, but they never get all the fibroids out. And they rarely mention that.
Really?
They often, they very typically leave behind living fibroids in the uterus. So they don't get them all out. And so the ones they leave behind, they start growing immediately. And there's an 11% rate of recurrence per year. So within 5 years, over half the women have their symptoms back because the smaller ones have now grown up to become bigger ones. So there's a very high recurrence rate with myomectomy. We've already mentioned that if they get pregnant, they're going to get a C-section, more surgery. So UFE, all the fibroids are knocked out, all of them. So the recurrence rate with UFE is extremely low. And so it's another big difference between the two procedures.
Yes, absolutely.
And you gotta know all your options.
Yeah. Any side effects to the ideal procedure of UFE?
Well, any procedure has risk, no matter. But the risk of a procedure that is a 30-minute procedure where you're going home the same day with a Band-Aid obviously pales in comparison to the risks of cutting you open surgically. But there are a couple of risks that are very unlikely. The first is there are some women that do not menstruate ever again after a UFE procedure. Now, I've never seen that happen to anybody under the age of 40. As you get above 40, you start to see it. 40 to 45, about 1 to 2%. 46 to 49, about 5 to 10%. 50 and above, now we're talking about 20% or so. But when I tell women, particularly say 45 and older, when I tell them the first risk of the procedure is that they may not menstruate ever again, it's usually followed by several minutes of uncontrolled laughter because they have crime scene-like periods. And the thought, a woman say in her late 40s with crime scene-like periods going, I hope that's me, doc. Make sure that's me. So that's the first risk. The other risk is about 5% of women will temporarily pass vaginally some fibroid material, and that's okay. Some people do it spontaneously before the UFE procedure if they have so many fibroids. It's unusual, but after the UFE, about 5% of the women, that undergo the procedure, regardless of age, will temporarily pass some fibroid material vaginally. It's fine. It's, in a sense, you're helping your own cause, if you will. But
Right.
the point is that most of these women have never seen this before, and I don't want to alarm them because, all of a sudden you have a procedure, and then for the next period or two, you're passing this material you've never seen. So I want to reassure them, first of all, that's what it is. You're just passing temporarily some of your own fibroid stuff. It's totally fine, and leave it alone. Don't try to flush it out or douche or steam or any of that. Just let it go.
Amazing. Thank you, Dr. Lipman. I appreciate such detailed information. And you did share that we have the location here in Atlanta. I do know that you also have a location in Richmond, Virginia, and
We do. We
I
just
believe DC.
started. Yep. We're looking, expanding. We hope to have another center here in Atlanta very soon. We have a center opening in Richmond. We hope to have several other centers here within the next few months. So it's an exciting time at Atlanta Fibroid Center. We're thrilled with the opportunity to get this message across, because it's been almost 30 years that we've been doing UFE. It's one of the biggest medical breakthroughs for women, and yet most women never hear about it. All the gynecologists know about it, but most decide not to share for whatever reason. And it's unfortunate. So I'm so the opportunity to tell your audience, no matter what your gynecologist tells you, if you're suffering with fibroids, you don't have to have a hysterectomy. It's an option, but it should be the option of last resort, because UFEs, the success rate is over 90%. So it's very likely you'll get the relief you're looking for. That's important. That's why you sought us out. You avoid completely the risks and long recovery of surgery. And importantly, and as we just mentioned, often underappreciated by many doctors, you get to keep your uterus, which is huge, even in family complete women.
And you take insurance at your centers, right?
Yes, the procedure, that's an important, all insurance companies cover UFE. It's been around a long time. It was even endorsed by the American College of Obstetrics and Gynecologists back in 2008. So it's been 17 years. They gave it the highest level of medical evidence, level A. Very few things ever get level A. So it had the highest level of medical evidence for safety and efficacy for treating fibroids, but it doesn't seem to have affected their rank and file. They still don't tell them, but I'm hoping we're going to get more research into fibroids. That's really important. And there's actually pending legislation. It's been pending for a long time, unfortunately. The Stephanie Tubbs Jones Fibroid Research and Education Act. Stephanie Tubbs Jones was a congresswoman, but unfortunately, she had fibroids, but she passed away from other things.
Wow.
And that was sad, because she was a real champion for fibroids. Her legislation does two things. It gives the NIH $30 million a year for the next 5 years. As we said, they're only getting about 18 million right now. So they get 30 million additional per year for 5 years, solely to try to understand where fibroids come from and important fibroid research. And then the other part of it, it directs the CDC to educate physicians and the lay public on this great alternatives to surgery like UFE, which would be so important and so necessary. But unfortunately, there are a lot of signatures on this legislation. In the House of Representatives, the champion there is Yvette Clarke, a congresswoman from New York. And on the Senate side is Cory Booker. But all the signatures to date, unfortunately, have a D after their name. There isn't any R's. And I've been working to try to get some R's, like Tim Scott from South Carolina. He's an African-American male. And so this should not be a partisan issue. He's an African-American gentleman. He should, I'm sure he has lots of women in his life. He may even be aware of fibroids, but regardless, he should have his signature on there, and there should be a lot of other R's on there so that we can get this necessary legislation passed so that we can finally get to the bottom of where fibroids come from.
So if I were
Yes.
to ask you if there was something that you could change in the medical industry, would that be something that you would change?
Absolutely. We want to get more research. We got in Georgia here, we got to expand Medicaid. I mean, there are dollars, Medicaid dollars that the federal government has allocated for Georgia that we have said, no, thank you. And that's really hard to, when people are suffering and struggling as they are, to not have the expansion of Medicaid, I think is just wrong.
Yeah, yeah. Well, you know, I want you to know that we really, truly appreciate you joining us this evening. I feel the need to call you back later as things expand in your centers and as you move around the country informing and educating people. You know, our organization, our show is, the relevance of our show is to educate and empower people with infinite perspectives and infinite possibilities. So we thank you for joining us this evening. And if I can say this, and hopefully you can agree with me, is that self-care is not self-indulgence. And it is our self-preservation and healing so that we don't bleed on other people who did not cut us, you know.
Absolutely.
But change from the inside out. We have to be proactive with our health.
Oh, it's so important. I spoke to a group of mothers recently, and they are so important. And I told them, even in my family, when my kids were younger, my kids are all grown now, but even when my kids were around, you know, even though I'm a physician, my wife was responsible for the health care of the family. And so when mama's not feeling well, the whole family suffers. And so it is so important to, you know, self-care is not selfish. It's important because you have a lot of responsibility beyond yourself. And if you're not well, you can't care for the others that you need to care for that rely on you.
Absolutely.
Absolutely. And that's why we here at Infinite Perspective believe in perspectives, because everybody's perspective matters, as well as infinite possibilities, because the possibilities are endless. And we always have to remember to implement radical self-care. That is so important.
Thank you, Dr. Lipman. We appreciate you so much.
Oh, thanks for having me. I really appreciate your time.
Absolutely. We're going to have you back because there's so much more that we have to delve into. Absolutely. Thank you very much for joining us for another amazing episode. You're welcome, Dr. Lipman.
Thanks again.
And to our viewers, thank you for tuning in and getting this crucial information. Please share with your loved ones. We do have the link. The video is here, always available for replay. And as you hear, we will call Dr. Lipman back. If he accepts and come back on, we will delve into so much more.
And you can find me on my website, atlii.com, atlii.com.
Yes, right on the banner below. And if you'd like to call, you can directly call them at 770-953-2600 and make an appointment.
It doesn't matter where you live, right? It doesn't matter what state you're in.
We see people from all over, even sometimes.
How you gonna change the things around you? Oh, what you gonna love inside of you? Oh, when you gonna hear his revelation?